Welcome back to the programme. Now, the lockdown here has felt long and hard enough. But in the Philippines, more than 32 million children, a third of the population, have been required to remain in their residences at all times as part of the government's efforts to curb the spread of COVID-19, and that has continued for a year. While restrictions have been eased for working-age adults, children have been required to stay at home along with the oldest members of society who are deemed most vulnerable. Meanwhile, uptake of the vaccines on offer has been low. Only 2 out of 10 want the vaccine in spite of reassurances of its safety and effectiveness. Well, joining me to discuss the situation in the Philippines, I'm joined by Red Mendoza, who's a reporter for the Manila Times. Hello, Red.
Good evening, Carol, and thank you for having me.
Thank you very much indeed for joining me tonight. Just tell me, first of all, it must have been absolutely dreadful for children being stuck at home for almost a year.
Yes, I think children have been locked down at their homes for, more than a year, almost a year already. The lockdown started on March 15th of last year, and then it's been going on for a year. There were proposals by some members of the government's council who are coordinating with the pandemic to ease the restrictions for children, but President Rodrigo Duterte abandoned it because basically of the spread of the new variants here in the country. We have cases of the so-called United Kingdom variant, and also just only last Monday we had announced that the South African variant has already arrived here in the country.
Has there been much research, though, on the effect, in particular, on children? I mean, being told to stay at home for a few weeks or months is hard enough, but that long without seeing any of their friends?
Yes, there were studies made and researches made, of course, on the effects of the pandemic on children, but our medical society in charge of pediatrics, the Philippine Pediatric Society, and the Philippine Pediatric Infectious Diseases Society of the Philippines are very well stern in their recommendation not to allow children to go out because they are considered to be super spreaders when they go out. Just last December, there were proposals to allow children to go out for the holiday season, but the government nixed the idea because of their threat to become COVID super spreaders.
So all the schools, I presume, are closed. Are children learning at home online?
Yes, right now children are learning at home online through multiple modes. There is, of course, the online media, but you also have distance learning through television, radio. In fact, one of the stations here in the Philippines has blocked, the Department of Education here in the Philippines has blocked time lease for a TV station in the Philippines to do distance learning using television.
Have parents generally just accepted this and decided that for the wider safety of society, it's best to keep the children in? Or has there been some anger, some resentment at this?
Some parents, I think, just accept the fact that they have to keep their children at home because they know the virus is very dangerous, it's very contagious. But some parents are also a bit more leery or very wary about how the pandemic could affect especially the mental health of their kids because they've been in lockdown for so long. They only meet their friends through online means. I know for the kids it's a bit easy for them to meet their friends online, but some of them may experience some mental issues, and that is very worrying. It's a very worrying trend. We don't have details on mental health issues. The Department of Health still has to issue those figures, but for the most part, I think some parents are happy, but some of them are not that happy as well.
Are the children allowed to go out, for example, to the local playgrounds or to the parks, anything like that?
Yes, there are some local regulations that allow children to go out in outside of their homes, in their nearby playgrounds. But for the most part, they are not allowed to go out, venture outside of their around the city. Like for example, here in Manila, they're not allowed to go outside to their provinces. They're just allowed to go outside of their home just to bask off on the sun. But anything else, it's not allowed. Children are not allowed to go outside.
What about for the rest of society? What sort of restrictions are still in place?
Well, right now the restrictions only apply for senior citizens. Well, our coordinating council for the pandemic management, which is called the Interagency Task Force for Management of the Emerging Infectious Diseases, has already allowed seniors who are able to go out, and of course, adults aged 15 to 65 years old are also now allowed to go out. Of course, when they have to work. But right now, basically, all adults right now are allowed outside except for children.
But what about restaurants, cafes, bars, that sort of thing? Are they open?
Yeah. Restaurants, bars, and cafes are open, but at a limited capacity. Right now, Metro Manila is in the so-called general community quarantine. We are just allowing 50% capacity for restaurants to operate. In more lenient areas called modified general community quarantine, they are allowed up to 75%. And it's hoped that once the vaccine rollout is being rolled out gradually, it may go into 75 to 100% capacity.
Okay, Red Mendoza, reporter for the Manila Times. Thank you very much indeed for joining us tonight and explaining the plight of children across the country locked in their homes, more or less, for almost a year now. Thanks so much for joining us here on Times Radio.
Across the UK, on DAB, online and on your smart speaker. This is Times Radio.